used to be a time when you would say joint replacement surgery and people would absolutely panic thinking about it. But we've now come to a point where it's not that big a deal when a doctor says that. Give us an idea, if you will, of the history and how we went from something that was so traumatic to something now that is seemingly just almost another part of the medical day.
It's a great question, Ed. Thank you for bringing that topic up. I wouldn't put it as it's such a simple topic because it is complicated. There's a lot that goes into joint replacement surgery. And for some people, it's a life-altering decision. But things have changed dramatically over the past few years to the point where people will have quicker recoveries, they'll be able to retain their quality of life and return to most of the activities they want to be returning to. But there is still a lot that goes into the decision, and I want to emphasize the importance of doing things before you get to the decision of making surgery as well.
Well, that's just it. You have the opportunity to make people more aware of what goes on, and I think you hit on it because we hear it so often about replacement surgery. Here it is, boom, no big deal, walk away and everybody's happy. It's really not that easy. I think sometimes television reports, medical shows sometimes make it seem a little easier than it really is.
I totally agree. And part of what I do is manage people's expectations and make sure that they understand what they're getting themselves into. But also keep in mind, it's probably one of the most successful elective surgeries we have. And we see people to returning almost to full activity, and in some cases back to full activity with almost no restrictions after certain types of joint replacement surgery.